Welcome to Hands-On University's Dental Assisting Curriculum Overview. We are excited to introduce our hands-on approach that leads to bright, successful dental assistants. Let's talk details. You will be provided with the following: a curriculum map, weekly checklists, teachable lesson plans, and a plethora of student-teacher resources to access throughout the duration of the course. Here we have the curriculum map. This is the basis of our program and is a general outline of the course. To start, students will learn about the naming of teeth in accordance with their set, arch, class, type, and side, in addition to learning about the teeth structures of which they are made and their distinguishing features. Next, students will learn about practices regarding sterilization and disinfection of treatment rooms, dental instruments, OSHA standards, and infectious materials. In the radiology unit, students will be introduced to techniques and practice of safely mounting and taking digital x-rays, and they will learn how to assist by using four-handed chair-side dentistry, including greeting, seating, preparing, and dismissing patients. Students will also learn treatment care room setup, which includes tray procedures, identifying and transferring instruments, breaking down treatment care rooms, and sterilization, and will be learning and practicing moisture control. Within the diagnostics unit, students will be exploring diagnostic materials, which will include custom impression trays and impressions and pouring up and trimming casts. Also, students will be learning how to make a custom night guard and whitening trays. The back office and Dentrix model will cover the etiquette and the responsibilities of the dental assistant in answering the telephone, greeting and welcoming the patients, how to enter patients' information and data, creating treatment plans, learning how to clinical chart, and create reports. At the end of the program, students will review general safety measures and review CPR. Here's an example of what each weekly checklist will look like. These lists will be distributed to each student weekly to ensure that they stay on track and can plan accordingly. As part of the curriculum, you will have access to all lesson plans for each week. These include the lesson's outcomes or student objectives, instructional aids needed, the topics that will be introduced, and strategies to implement throughout the lesson. Students will not have access to this. It is strictly for instructors only. These weekly lesson plans are the roadmaps for each session, meaning any doctor or instructor can review a lesson plan and be adequately prepared to teach. Here we have an example of the lecture notes. These include the overview of each topic and important points to highlight during the lecture. Within the weekly lesson plans are visuals such as this and are available for you to print or share with students. There are PowerPoints for each chapter. All include visuals and description slides. This is a valuable tool as it allows for both visual and audio-spatial learners to take in the information. The PowerPoints are downloadable, and the instructor can easily adjust the presentation to fit in with their class schedule and needs. During lectures, this is an example of a great student handout to utilize. It provides students with the content from the lecture and a space for them to highlight and note take as needed. The Hands-On Portal is a unique resource to our program and gives teachers and students the flexibility to access course materials in their own time. As you can see, there are multiple tools that can be accessed. The course calendar is a great resource as students will have an understanding of when the classes are due and ultimately help them plan. The gradebook function keeps an accurate record of student records and their progress in the course. Instructors have the ability to add assignments, change due dates, the allotted points per assignment, and keep track of course totals. You also have the ability to print and export the gradebook as needed. The login report assists you in keeping track of what students are consistently utilizing the online resources. Another unique student resource is the interactive dental office. The top part demonstrates the patient case studies. Students are given 30 patients to choose from. Once they click on their name, they are given the patient's information and anything needed to properly treat them. On the bottom, students are put through a series of charting exercises. Also, students have access to radiography exercises, glossary, numbering system, and patient handouts. Students have access to this awesome resource throughout the duration of the course and can practice on their own time. Instructors could assign this as an extra assignment if wanted. Lastly, students can check their grades and keep track of how well they are doing. This is a good way for them to gauge if they need to receive extra help or study more.
Preparing, placing, and removing the dental dam. Review your tray setup, making sure you have the equipment and supplies required. Use the mouth mirror and the Explorer to examine the site where the dam is to be placed. It should be free of plaque and debris. Floss all contacts involved in placement of the dental dam. After using a template or stamp, mark on the dam the teeth to be isolated. Correctly punch the marked dam according to the teeth to be isolated. Be sure to use the correct size of punch hole for the specific tooth. To ease placement of the dam with tight contacts, lightly lubricate the holes undersurface of the dam with a water-soluble lubricant. Select the correct size of clamp. Secure the clamp by tying a ligature of dental tape on the bow of the clamp. Place the beaks of the rubber dam forceps into the holes of the clamp. Position the lingual jaws of the clamp first, then the facial jaws. Following placement, check to see if the clamp is stabilized on the tooth and check for fit. Use cotton pliers to retrieve the ligature so that it is exposed and easy to grasp if necessary. Transfer the dental dam to the site and stretch the punched hole for the anchor tooth over the clamp. Position the frame over the dam and slightly pull the dam, allowing it to hook onto the projections of the frame to ensure a smooth and stable fit. This will stabilize the dam and aid in locating the remaining punch holes for the teeth to be isolated. Using your index fingers, stretch the dam on the lingual and facial surfaces of the teeth so that the dam slides through each contact area. With a piece of dental tape or waxed floss, floss through the contacts, pushing the dam below the proximal contacts of each tooth that is to be isolated. When removing floss, slide it through the contact facially rather than popping it back out. This will keep the dam in place. A ligature is placed to stabilize the dam at the opposite end of the anchor tooth. Invert or reverse the dam by gently stretching it near the cervix of the tooth. A black spoon, FP1, or beaver tail burnisher can be used to invert the edges of the dam. Inverting the dam creates a seal to prevent the leakage of saliva. Apply air from the air-water syringe to the tooth that is being inverted to help in turning the dam material under. When all punched holes are properly inverted, the dental dam application is complete. When removing the dental dam, slide your finger under the dam parallel to the arch and pull outward so you are stretching the holes away from the isolated teeth. Use the crown and bridge scissors to cut from hole to hole, creating one long cut. When all septa are cut, the dam is pulled to free the rubber from the interproximal space. Remove any ligatures at this time. Grasp the dental dam forceps and position the beaks into the holes of the clamp and open the clamp by squeezing the handle. Gently remove the clamp from the tooth. Remove both the dam and the frame at one time, making sure to remove any dam material from the interproximal surfaces. Inspect the dam to ensure that the entire pattern of the torn septa of the dental dam has been removed. If a fragment of the dental dam is missing, use dental floss to check the corresponding interproximal area of the oral cavity.
Mornings we lecture, after lunch we come in, whatever we lectured on is hands-on in the afternoon. For our weekday class, we'll do the same thing we did Sunday afternoon. We'll do more practice on that. And then we also do quizzes on the Thursday night class. Yeah. So we'll do that before we actually get back into the lab. So it's all hands-on, and usually when we come in, you guys know where everything is, and you just grab what you need and go.
I chose this program because it's a shorter course and it's hands-on, and I needed to get in the workforce as fast as possible.
I chose this program because of the accelerated course and the hands-on training that we learn, and I absolutely love it.
I really like it. I enjoy the teachers are really nice, and I feel like I'm learning a lot, and it's fun.
This program is all hands-on. You're learning everything that you would do in a regular dental office. You get a feel for what you'd be doing every day, and that really helps because you've already done it, you've already practiced it, so you know a little more of what you're going to do once you actually get in there.
I love it. Like all the hands-on, I love it. Like I am a visual learner, so this works perfectly.
I chose this program because it was only a 35-minute drive from my house, and it was a shorter time than all the other schools that I could find.
I would definitely recommend this to anyone who is looking to start a career in dental assisting because of the hands-on experience, because of the fact that everything is in an office and you get to practice a lot of the things that you would do in a real office, which helps tremendously.
Ready to purchase and get started? When you purchase our program, you will receive the 9 binders which are included in our proprietary curriculum. You will receive the following: an administration guide, marketing guide, teaching instructor's guide, exams, quizzes, labs, state compliance information, hands-on university online portal guide, lectures, lecture notes, and record-keeping guide. In total, you will receive all 9 volumes of our school system. Thank you for choosing us. We look forward to serving you. For more information, please call 1-800-906-0954. Thank you for watching the Hands-On University Dental Assisting School Curriculum Overview.